Good morning, everyone. I'm Muriel Bowser. I'm the mayor of Washington, D.C. I'm joined today by Dr. LaQuandra Nesbitt and Dr. Chris Rodriguez, members of my administration, to provide an update on the district's response to COVID and other timely issues. We are also joined today by Council Chairman Phil Mendelson, who has joined us throughout our response to the pandemic prior to his legislative session to provide a legislative briefing. So I will turn it over very shortly to Mr. Mendelson to provide that briefing, and then he will take questions. We will provide a brief update and also take questions. So we want to highlight, of course, today is the start of Black History Month, and we look forward this month throughout district government to spotlighting our local history and culture as well as local equity initiatives. And that includes today we will be posting a job opportunity in the district, a very important job opportunity for the Chief Equity Officer for the District of Columbia. So if you're interested in applying or sharing this position with those who you know have the experience to advise the district on equity issues, please go to Mayor.dc.gov. Mayor.dc.gov. And as we do each year, we will also be engaging members of the public on our budget issues. This year, obviously, will be a little different. This will be my 7th year of budget engagement forums, and we're going to do 4, as you see listed there, and we will provide information to you about how you can participate virtually. So you can go to budget.dc.gov and remember the dates. The same information is presented, so you don't have to attend all 4. You can choose the one that works for your schedule. The senior, with the exception of the senior budget engagement forum, which will have some focus on older adults. So once again, those dates are February 10th, 16th, 18th, and Saturday, February the 20th. So with that, I'm going to turn to the chairman for his update.
Thank you, Mayor Bowser, and good morning. The council is having its regular monthly legislative meeting tomorrow, Tuesday, February 2nd, starting at noon. Our legislative meetings now start at noon rather than 10 a.m. And we have a breakfast. It's a virtual breakfast at 9 a.m., which is open to the public. You would have to go to the council's website to figure out how to access it. The items on the agenda include 7 congressional review emergencies. And I'm mentioning this because I expect that we will be seeing many more of these emergencies over the next couple of months. A congressional review emergency is where the council is trying to implement legislation quickly, legislation that has been transmitted to the Hill, but because of the delay of the congressional review period, it's a long delay, and so we have to adopt these emergency bills, the congressional review emergency bills, to fill the legislative gap. It's a bit frustrating. The bills that we passed last fall, beginning, I believe, in October, every one of them has to be resubmitted in the month of January. I'm going to say a little bit more about that in a second. So the clock starts over, and then it's the 30 congressional review days. I'm going to say a little bit more, and I'm going to say it under the term fences. So as you all know, there is a fence around the Capitol complex. And why am I bringing that up? Because we have a requirement, the council has a requirement under the Home Rule Act to transmit all legislation to Congress for congressional review. But we can't get through those fences. So our office, the secretary to the Council of the District of Columbia, has been trying to figure out for the last week or so, the last 10 days, how we can deliver legislation because we cannot get through the fence, literally, that's around the Capitol to deliver the legislation so that we meet our requirement for the 30-day congressional review. So I expect that we will be seeing more of these congressional review emergencies over the next couple of months. We also have on the agenda for tomorrow 7 contracts and 6 emergency bills. One of those emergency bills
was submitted at is being considered at the request of the mayor, and it is entitled the District Government Parental Bereavement Leave Emergency Amendment Act. And what this bill will do is it will provide 2 weeks of paid leave for bereavement related to death of a child, a late-term miscarriage, or a stillbirth. There are several other emergency bills. I don't think that they're particularly controversial or noteworthy in the sense of the one I just mentioned. There is on the agenda 2 bills that the mayor vetoed that will be moved for override. They were approved in December, both readings unanimously, and so I expect that they will be approved again tomorrow unanimously. I want to mention a few other things, and then I'll take questions. We have a hearing this Wednesday on the Comprehensive Annual Financial Review, the CAFR. This is the annual audit that's done of the city's finances. And so we will have a hearing in the afternoon. I believe it's at 3 o'clock this Wednesday. I do want to note a few things, because if anybody's been looking, the CAFR is quite healthy. Shows that we ended the fiscal year in a better than expected position. And actually, when I say healthy, it's in the context of the recession that we're in. The fund balance, I want to note this about the fund balance. It is a September 30th figure. And why am I saying that? Because some of that fund balance is money that was reserved for the current year fiscal budget. So on October 1st, that's already in the budget, and in that sense, no longer in the fund balance. The fund balance also includes our rainy day reserves. And for those who think that we need to be spending our reserves, we are actually actively using, when I say we, probably I should say the mayor, the executive, and the chief financial officer are actively using those 3 of the 4 reserves. The cash flow, which avoids our having to borrow money for cash flow purposes. One of the reserves is being used to help balance the fiscal year, the current year budget, so it's being spent as part of this year's operations. And then the third is being used for unforeseen needs that may be reimbursed. And as we've seen over the last 9-10 months, there are an awful lot of unforeseen needs that have cost a considerable amount that we hope we will get reimbursed, and that's part of the reserves as well, which is part of the fund balance. And then bond escrow is another major component. Why am I saying all this? Because folks look at the fund balance and they say, oh, there's all this money that can be spent on these different programs, and it's already been allocated. The surplus from the last fiscal year, and we'll be going into all this at the hearing on Wednesday, is that surplus automatically, most of it automatically went into the Housing Production Trust Fund and infrastructure. It can be used to help cover the $143 million shortfall that still shows in the Chief Financial Officer's revenue estimates for the current fiscal year, and the shortfall over the financial plan, which is $461 million. So I've not talked to the mayor about her intentions, and I'm not sure that she's developed her intentions fully for the budget that she'll submit March 31st. But this money is in the context of a tight budget and is largely spoken for. The Committee of the Whole will have a hearing on February 10th on learning loss, and that will be, this is in the schools, public schools. To what extent are we seeing that distance learning has actually set back education for a lot of kids? So we'll be talking about that, but it also will be an opportunity to look at some of the issues around reopening schools, which I know is of concern to many individuals. I have to emphasize that the hearing next week, the witness list is limited because we were focusing on experts coming in and talking to us about learning loss as well as practices in other jurisdictions. We are having a hearing that will be a 9-hour hearing set aside for first to testify testimony from the public. That's March 9th. The other thing I want to mention, and I'll take questions, is that the council has revisited its hearing schedule for the spring. Through the first 3-4 months of the pandemic last year, the council was not having any hearings, and then we opened it up to having one hearing at a time, usually in 3-hour segments. We are now having 2 hearings at a time, so we are trying to loosen up and allow more hearings by the different committees, and therefore more opportunity for the public to testify in matters before the council. And that is reflected in the agenda, the schedule for the performance and budget hearings. We've already published that schedule, so it's available so that folks can see when we're having hearings on agencies that are of interest to them. With that, I'm happy to take some questions, and then I'll turn it back to the mayor. I think that's Sam.
Yes. So, Mr. Chairman, two questions here. First, what are the two bills to override? Are you saying you physically cannot get through the paper has to be physically handed to some particular office at the Capitol and you can't get there?
Yes, that's what I'm saying. I'll say more about that in a second. The two bills are the Department of Buildings Establishment Act and the Office of the Ombudsperson for Children Establishment Amendment Act. The first deals with DCRA, breaking that up into two agencies, and the second deals with the Child and Family Services Agency, CFSA, and creating an independent ombudsman or ombudsperson office. What I'm saying is literally what I'm saying. We are required to transmit legislation after the mayor signed it to Congress. We have to submit to the Speaker of the House and the President of the Senate. We do that for every bill. And we're required to deliver that legislation in person. This has been happening for decades. In fact, they won't even allow a signature stamp, which is fine with me, so I have to sign each transmittal letter, and then we deliver it in person. And we are unable to get through the fences. So we have been trying to find a way to deliver the legislation, transmit the legislation as we're required to do. Yes, that's what I'm saying, is that we've been blocked in doing that. And it just speaks to the challenge with our limited home rule government. Or I could put that differently. It speaks to why we ought to have statehood, because, it's ridiculous that we transmit legislation to Congress, which they've done nothing with since like 1991 or 1992. And here we are. This is an example of where, they're not thinking of us when they put the fence around the Capitol, but it affects us and a requirement they imposed on us. We literally cannot deliver the legislation.
And what have they said? Have you talked to anybody up there that's commented on this?
The Secretary of the Council has been working with the two offices to figure out how we can deliver the legislation. Perry?
On these two vetoed, or these two bills, a question for both of you. First, why do you think you guys stand so far apart on your stances on these bills? And Chairman, do you think you have the 9 votes? And if so, Mayor Bowser, how do you feel about these two, your veto being overridden?
Well, let me begin by saying that I appreciate the mayor's graciousness that we combine these press conferences, so it does create a little bit of an awkward situation here. But I'll say this, a lot of legislation, in fact, most legislation is about policy. And in a well-functioning democratic government, there are going to be disagreements on policy between the two branches. What is the best way to ensure the best DCRA, or the best way to ensure the best Child and Family Services Agency? These are complicated policy issues. The council has a view. We articulated that in this legislation. So what you're seeing is democracy at work. You're seeing some disagreement on policy. And I think that's fair. I actually think that even though there's some interest around this, that if you look at the overall legislative record, I think the mayor's vetoed maybe 3 bills before this, out of the hundreds of bills that we passed every council period.
And do you think you have the 9 votes?
Yes.
How do you feel about these bills likely being vetoed?
Well, my position on the bills is a long-standing one, Perry, and it is true that I have not vetoed a lot of bills because it is, as a person who's been on the council and sits in this seat, I know that the council will have its policy goals that don't always mirror mine. I do, however, think that we have to be very careful about creating more government that doesn't create better results. And I think that's the position that we're in with both of these bills. We certainly have been very focused on making DCRA more responsive to the residents of the district, more focused on how we can have safer building and enforce all of our rules and regulations. And I don't think that we get there by creating a new director of this, a new general counsel for that, and another bureaucracy. So that's been my concern. On the issues related to CFSA, they're similar. We would create a new and conflicting, and I think illegal positions in the government, and I cannot put my signature to that because I know that that is going to be very difficult to implement. Further, both of these bills require more money, more funding, and so as we go into a new budget season, we're going to have to ask, how are we going to pay for all of this?
So if you were on the council still, you probably would have voted against these bills?
Well, I haven't been on the council in a long time. So my job now, if there's a piece of legislation, is, I try to speak out against it, have our agency directors testify against it before it's final. There are a lot of things that I won't sign, but I will still let them proceed. But these, in my view, violate some principles that we had going into this budget season of creating bigger government and unfunded legislation.
Thank you.
For the chairman, do you have a response to Mayor Bowser's specific concerns that splitting this agency in two will create more bureaucracy? And I think Mayor Bowser said the CFSA bill would do something illegal, create this entity that is not compliant with the law.
Well, let me say this, but then if any of you want to develop this story further, I would suggest, I'm open to talking with you individually about it. Our general counsel has looked at both measures and believes that they're legally sufficient. So you're seeing a disagreement between the branches of government, and that happens in a healthy democracy. The other point I would say in response to your question, Mitch, is that a DCRA was a combination of, I think it was maybe a dozen agencies back in the mid-1980s. And I will characterize that as an experiment, and that 35 years later, we see an agency that for 35 years has struggled. And I think a reason why it has struggled is because it is so large. And so we think that this is the better approach. Mark.
Yeah, Chairman Mendelson, if I could go back to the fence and the legislation getting up to the Hill, how many bills are stacked up waiting?
About 60.
I'm sorry?
About 60.
6-0?
Yes.
And what is the timeline on those? And what happens? I mean, if they don't ever get there, is there a deadline on these where they die or they automatically go into effect? I mean, I guess this is uncharted waters for you, but what happens should this not get resolved?
Well, let me deal with the infinity question first, and that is, I don't think the fences will be around the Capitol forever, or that, at least I hope they won't be. Even if they are, sooner or later there's going to be a gate that opens. So I don't think that this is going to go on for years and years. There is not a time limit in the Home Rule Act, but so what? We're required when we pass legislation to send it to the Hill. The mayor's asked us to consider this emergency bill tomorrow with regard to bereavement benefits. Perfectly reasonable, and if any of you followed the news, you know there was a situation with a teacher who had a stillbirth, and we want to help. And so in order for that to happen, the law, what we pass and the mayor signs has to be has to go through the full process. We can do it as an emergency, that's good for 90 days, but the permanent legislation, it's got to go through the full process. So we've got to be able to deliver our bills to the Congress. And it is this crazy home rule situation, which would be avoided if we had statehood. I'm pausing though because I'm thinking about National Guard was a recent lesson. It is an irrational and unsustainable situation that we cannot pass
permanent legislation that can become permanent law, because right now we are struggling with how we deliver these bills to Congress.
And so the permanent legislation just stalls until this is rectified?
Well, I've talked with the Secretary of the Council. She's trying to find ways to get the legislation delivered, and we may find a way. We actually had problems back in the summer. They weren't this dramatic. The Vice President's office, he's the President of the Senate, his office was closed, and we actually went through, I think it was a week or two, trying to deliver bills. Actually gave the bills to somebody, and then they ended up in the Speaker's office, who called us. We had to pick them up and find another way to deliver them. It just shouldn't be this way.
And then can I just ask on a large issue, other than you just not being able to deliver these bills, the fencing that divides this side of the hill from getting to Capitol Hill spans from the freeway up to this block, as a matter of fact, making it impassable by cars or pedestrians. Knowing where you live and where you work, this greatly impacts your commute, I assume, back and forth to work. What are your thoughts just on how far the reach is beyond just the Capitol campus, that this fence that stops at 3rd Street is impacting your neighbors on Capitol Hill and the businesses there?
First, let me be clear. My perspective on this is not influenced by my own personal experience, and I have found ways to get downtown. So this is not about me at all. I think it's outrageous, the fencing around the Capitol. I think it is antithetical to the open society that is a core American value. I think it also is not the solution to terrorism or violence. It just is not the solution. And then it also creates an enormous burden on the city, on the local government.
Mayor Bowser, could I ask you about that while we're on this topic? Just your thoughts on whether or not, I mean, you've talked about the need for security there, but the perimeter is vast and goes way beyond just the House and Senate office buildings and the Capitol proper, and really impacts the ability for delivery trucks, residents, workers, emergency vehicles to get from where we are right now, just a few blocks up to the Capitol. What are your thoughts on whether or not that's an overreach and how it's impacting residents and businesses up on Capitol Hill?
Well, I think that I would agree with the chairman. I don't have much more to add other than we have to better understand how the Congress is proceeding with reimagining its security. And so I think the generous view is that there was an emergency, there's an upcoming national special security event, they're resetting and regrouping, and then they're going to move into a more permanent security posture. So that's the generous view. But I don't think there's been a lot of transparency on their process at this stage. And so our perspective from the city is obviously we want our institutions to be safe. We want our lawmakers to be safe, but we don't want the Capitol grounds closed down, and we certainly don't want this movement, this creep onto D.C. streets and D.C. neighborhoods. I'm sorry, this is the chairman's floor.
For Mayor Bowser, on the bill regarding CFSA oversight, so regardless of your concerns over legal sufficiency, are you confident in the mechanisms in place now that oversee that agency?
I am. And as you know, this agency has been under court review for a number of years. And the agreements between the agency and the court monitor are strong, and we actually see our future out from under court oversight. So I am.
You're not concerned about backslide at all? I know the council memo mentioned a concern over backsliding from federal oversight.
Well, I'm not concerned about it, and in my tenure, we have now come from under 2 court mandates, one at DDS and most recently at DYRS, actually in the last 2 months. And before we did, and I spoke to the court in both cases and let them know the mechanisms that we would put in place to prevent backslide. Your term. And that's what we've done. And so I make sure that we have either, in the case of DDS, internal team that's focused on all of the metrics, if you will, that we've put in place to make sure that our residents are protected in the system, and that it has the budget that it needs. And recently with DYRS, we also set up an office to maintain a close eye on all of the metrics that we had followed with DYRS young people for so many years, all to the satisfaction of a court monitor who has been very focused on making sure there's no retreat from the excellence that we're delivering. And that would be the same thing that we would do in the case of CFSA.
And one more for the chairman. The bill to split up DCRA would cost an estimated $33 million over the next 4 years, I believe. And it would also take at least a year, maybe more, to stand up these 2 separate agencies. Why does this bill need to go forward now when money is tight? Would it not be appropriate to wait until the end of the health emergency?
Money may be tight, particularly now because of the recession, but the argument that money is tight is always an ever-present argument. I recognize that this would take time, and starting now means that it happens that much sooner as opposed to waiting to start. The problem, the Committee of the Whole, which I chair, has had numerous oversight hearings on issues involving DCRA, that complaints about illegal construction, complaints about housing code enforcement. These are important issues, and we think that the bill will help with regard to resolving those. They're important enough that finding solutions to them should not wait.
Okay, we'll take a couple more in this round, Mr. Chairman.
Bill Rice, and then I'll go back to Perry.
There's also a newly created council office on racial equity. Can you comment in general about how you think that'll react and what, if any, interaction it might have with the new office the mayor just mentioned?
Sure. Both offices are a creation of the REACH Act, Racial Equity Achieves Results, that the council approved last fall, and the mayor approved. It's probably one of those bills we're trying to get through the fences at Congress. The bill sets up requirements for looking at racial equity on the executive side of the government, and then requirements for the council to be assessing racial equity when it's considering legislation. So there's an office on the executive side. That's what the mayor spoke to. There's an office in the council. The council's office will be focused on legislation. It doesn't get into looking at what the executive's doing, because that's what the executive's office will do. What we are beginning to implement with this council period is, through our Office of Racial Equity, preparing racial equity assessments on most legislation, not 100%, but most legislation. And this is going to be new and different for the council, because it's going to require us, and that's exactly the point, it's going to require us to be thinking about racial equity when we're looking at legislation. I want to emphasize that, folks talk about racial equity, but it's not always crystal clear what is the best answer. And a good assessment is going to say, well, if you do this, could be the following impacts, and if you do that, there could be the following impacts. And it may not be a bright line in terms of what is the right course. But it will inform us of what is the better course in terms of racial equity, and it will raise our consciousness. When we adopted the legislation, at the time there was only one other jurisdiction in the country, which was Montgomery County, Maryland, that had something as broad as what we're doing, although I think we actually improved on what Montgomery County is doing. The few states that have this, they tie the racial equity analysis to criminal justice legislation. Ours will apply to everything.
When you say everything, you said it will not cover all legislation. Could you expand on that? And will it cover, for instance, the auditor, the budget office, and so forth?
I didn't get the last part.
Will it also cover such things as what the auditor does?
No. No, it's
well, then-
on legislation.
And
So-
what legislation and what
Well,
not?
for instance, it won't be ceremonial resolutions. You would have to look at the council rules. We explicitly say what's not included. Perry, you may be the last question.
Yeah, to Mayor Bowser, when you talked about your, the Racial Equity Office, how will you be measuring the effectiveness of it? How will you be able to determine if it's working and whether, input and recommendations are actually being taken into account?
I think you may be a little ahead of us in how the office will be laid out. As the chairman said, this office was created by the council. I think that we will hire a chief and several employees. So we're establishing the office, and the chief will help lay out some of those expectations.
Thank you.
Thank you, Mayor Bowser.
Thank you, Mr. Chairman. Okay, so I'm going to go quickly through the slides. Dr. Nesbitt has a hard stop, so I'm going to try to get to her items quickly so you can ask her questions. Let's start with snow. It snowed over the weekend, and Chris Rodriguez and HSEMA continue to work with the National Weather Service to make sure we have the best estimate of the weather and how that affects our operations. We had a snow emergency in place on Sunday. I want to thank all our residents who reacted quickly in moving their vehicles so our snow team could work. That emergency has been lifted. DCPS was all virtual today due to snow. DC government opened on time, but our COVID testing sites were down today due to the inclement weather. So if there are any changes to our operations based on any predictions today, we will get that information out as soon as possible. And we always try to make the evening newscast or by 10 o'clock for the nighttime newscast. We're also asking everyone to be focused on our neighbors experiencing homelessness. It's bitterly cold. We want people to come in. We have space. It's safe. So please call 311 or dial 202-397093. I wanted to say a little bit about Term 3, which begins in the district today for DC Public Schools. And we started, as I mentioned, with all virtual day, and this is distinct from a snow day, given that kids can go to school when it's snowing because of our virtual platforms. And so we are still on track to welcome kids back in person this week. We are proud that going into Term 3 that every teacher and staff member working in person in our schools was offered a vaccine, and approximately 3,100 teachers and staff have already received their first dose. We're also very proud that we implemented with our CARES classroom symptomatic and asymptomatic testing protocols for students and staff. Each of our schools has now, elementary and secondary schools, has an HVAC systems upgrade and a school plan that every community member or parent can review at DCPS reopenstrong.com and see the plans for each school. Let me also say a little bit more about vaccine. You see the number of doses that have been received from the feds, administered, the difference being those doses that are associated with scheduled appointments, and then the next doses we expect this week, almost 11,000 doses. DC is now vaccinating people in the following areas. People, first, individuals who are in healthcare settings, including our fire and emergency management team, residents of long-term and intermediate care facilities, DC residents who are 65 years or older, individuals experiencing homelessness, MPD, teachers and staff who are in person at DCPS or DC Public Charter School, Department of Corrections employees and residents, continuity of government operations personnel, that includes our emergency operations team, and licensed child care providers and teachers and staff of independent schools will begin to get an email about how to schedule an appointment for their vaccination beginning today. So eligible individuals will receive an email from the Office of the State Superintendent of Education. These vaccines are being delivered with one of our vaccinators, One Medical. Also, I'm about to turn over now to Dr. Nesbitt to talk more about what the data tell us about vaccines.
Sure. Thank you, Madam Mayor. So today, as promised last week, we released for the first time our partial data that we have on vaccinations by race and ethnicity. This data is available on coronavirus.dc.gov. As indicated, the data is incomplete. We continue to work with our healthcare providers to make this data more complete. 2 points of note. There is a vaccinate.dc.gov portal that a portion of the population uses to schedule an appointment for vaccination. The data that is collected in that system is not the same data that is used to report out on everyone who is vaccinated. There are 2 reasons for that. That system is only used to schedule appointments for a portion of the population. If you will recall on the previous slide, only healthcare workers and individuals over the age of 65, some individuals over the age of 65 are scheduling their appointments there. However, the district's immunization information system is the more complete authoritative source of information for everyone who is vaccinated in the District of Columbia and all district residents. That system is where healthcare providers report information to the District of Columbia about individuals. That system has information related to the individual's age, gender, address, race, and ethnicity. If healthcare providers do not collect information on race and ethnicity in the immunization information system, that data cannot be analyzed and provided to the public, and that data, more importantly, cannot help to drive the district's plan for a safe, effective, and equitable immunization program. That is why we're working with our healthcare providers, our COVID-19 vaccine providers, to make this data more complete and robust. No conclusions can be drawn by this race and ethnicity data. As you note, for race, there are over 11,000 missing data points, and the other category is inconsistent with other race and ethnicity reports from that DC Health typically provides. Similarly, for ethnicity, because an individual is typically reported as white, non-Hispanic, or white Hispanic, black, non-Hispanic, or black Hispanic, there are over 35,000 fields where the ethnicity for an individual has not been reported. Next slide. For our priority zip codes, the district has been focusing on priority zip codes that are typically located in wards 1, 4, 5, 7, and 8. And last week, we added an additional zip code, 20024, in Ward 6. You will note that the priority zip codes here show that over a total of 22.8% of the district's residents over the age of 65 have been vaccinated. This is the total number of individuals who have been vaccinated, regardless of whether or not they have scheduled their appointments through the district's Vaccinate.dc.gov system or by calling the 1-855-363-0333 number. These are total vaccinations. You will see that wards 5, 7, and 8 continue to lag behind all other wards. The zip codes, again, located in wards 5, 7, and 8, continue to lag behind. As such, we will continue to focus our priority zip codes for this week when we release appointments on Thursday at 9 a.m. on wards 5, 7, and 8, providing an opportunity for residents in those wards to have a greater opportunity for vaccination. As it relates to Vaccinate.dc.gov appointment scheduling, so these are individuals who are seeking an opportunity to have an appointment scheduled through Vaccinate.dc.gov by one of our community vaccinating sites, which are largely district retail pharmacies, district pharmacies in partnership with community recreation centers or community senior centers, and a portion of the appointments made available at federally qualified health centers. You will see that since implementing our equity approach, residents in wards 1 and 4 have increased their opportunities for accessing appointments through the scheduling center, and wards 2, 3, and 6 continue to have a greater level of access than residents in wards 5, 7, and 8. Again, further necessitating our need to continue to have an opportunity for priority zip codes to schedule. Thank you, Madam Mayor.
Thank you. And Dr. Nesbitt, you want to say anything about this
Sure.
scam that's out there?
Sure. In order to be a COVID-19 vaccine provider in the District of Columbia, you must be vetted and approved by the District of Columbia Department of Health. All vaccines that are provided for COVID-19 are authorized by the District of Columbia Department of Health, and the only places you can get a vaccine are through hospitals, clinics, pharmacies, and doctor's offices, and authorized on-site clinics by an enrolled and approved provider. There are no off-site sales of vaccines. No one will have to purchase a vaccine for a price and have it administered by anyone who considers themselves a healthcare provider or otherwise. If you see these types of scams or are contacted and offered to purchase a vaccine, please report these scams to the Metropolitan Police Department at 202-727-4159. We want to ensure that all of our residents have equitable access to vaccines in the District of Columbia and would like to have all scams reported. Thank you.
Thank you, Dr. Nesbitt. Lastly, I just want to highlight some work that Deputy Mayor Falchicchio and the DemPed team have been doing with DC bids throughout the city, especially in the downtown, in all of our downtown areas. And Chief Conti was also out in the community talking to business owners to make sure that he was focused on their concerns. But we're asking everybody to take down boards. We saw a number of these boards go up during the summer. Some of them have stayed throughout. Some are going up and down. And we're asking everybody to take down those boards. It makes the city safer. And there's also an opportunity to repurpose the wood that you've used in the Shaw Main Streets is coordinating that project. And the wood, I understand, will be repurposed through the Wood for Good project. So contact Shaw Main Streets Inc. at gmail.com if you're interested in participating in that program. The chairman has already talked about the good news related to our comprehensive annual financial report. And so much of the financial news that we've brought from this place has been dire. It is important that with every dollar that we have and that we're following, that our taxpayers know that we are doing the right things with it and our government is managing them in all the right ways. So for the second consecutive year, and this is something that the council, and I know the chairman is proud of this, as I am. The district has 60 days of operating reserves. Our pension and retiree health care funds remain fully funded. We have a AAA bond rating. We're going into our 6th consecutive year throughout my tenure, my administration, of having no audit findings that find material weaknesses or significant deficiencies in how we operate and handle our money. So I am very proud of this information. The council will hold its hearing. The city administrator will present and answer questions on behalf of my administration. So with that, we'll take questions. Yes, Sam.
Mayor, as I recall last week, you said you had about 200 people taking calls for people who were trying to get vaccinated. What number do you call? And I mean, 'cause I've gotten some feedback from people that have had difficulties.
People, I don't know if we have a slide that can show the number.
1-855-363-0333. Oh, sorry, 1-855-363-0333. However, Sam, the challenge isn't people not having the phone number. The challenge is we don't have enough vaccine. So when the number goes live, you have hundreds of people who are waiting in queue to get access to a limited number of vaccines, and they go very quickly. And this is not a challenge that is unique to the District of Columbia. We, as the mayor has mentioned, are going to receive 10,975 vaccines. We're trying to vaccinate 86,000 seniors. We've gotten 22% of them, or 1 in 5 of them, vaccinated so far. But when we receive those 10,975 vaccines, we allocate a portion of them to the call center, or call center and portal combined. We allocate a portion of them to healthcare providers, our hospitals, all of the district's hospitals, and about 7 or 8 community health centers or federally qualified health centers. That's another bucket. And then we allocate them to special initiatives or special populations, so the essential employees, the seniors who are homebound at home or living in high-density senior residential buildings, the teachers, the MPD or law enforcement folks, and then our DDS population. So that bucket of 10,975 has to be split 3 ways. And every time I get a request to do something for a special population, put more into senior residential housing, the number of appointments that can go into that call center and virtual and portal gets even smaller. So I think we really have to wrap our minds around it and have some full appreciation as a city for the limited number of vaccines that we are getting in the district and how it has to be split 3 ways every single week, and how that impacts people's ability to get an appointment, whether you're calling on the phone or going online. So I really want people to know, I hear you. I hear and fully understand how frustrating it must be to go online and have appointments go away or be gone completely in 20 minutes, how frustrating it must be to dial into a number at 9 a.m. and be caller number 300 and not get an appointment. We fully appreciate that. But it is also equally frustrating to be the health director of this city and only get 10% or less every week of what you really need.
So I guess your thing is to ask people to keep calling.
Well, well, we want everybody to get the vaccine when it's their term, Sam. And I think what we're trying to say is that the issue is scarcity. We have many different places where all of these people, and some of these categories overlap, by the way. And so whether you're going to your health plan because they're one of our vaccinators, a community clinic you can go to because they're one of our vaccinators, or you're calling on the line. These kind of frustrations will diminish as more vaccine becomes available.
Let me ask you this, because there's one gentleman in particular I'm thinking about. He calls and he says he's called and he can't get through. Can somebody else help these people who's computer literate? I mean, obviously, a lot of the people don't deal with computers. Can somebody, let's say can you help somebody who is not computer literate, say you don't live in their zip code or whatever?
We can ask one of our MOCers from the Mayor's Office of Community Affairs or one of our other constituencies' offices to kind of help somebody sign in. Yes, ma'am.
I have a a few school-related questions.
Sure.
We know that right now the reopening plan has a cap at 15,000. There's about last I checked, 9,000 something kids returning. Will you allow kids to, if their school, of course, has capacity, to go in person midterm?
The chancellor can better explain this, but we can't make staffing decisions kind of week to week. So there was a cutoff for parents to request in person. But as I understand it, there could be some ads or some ads depending on if another kid moves around.
Okay, because my understanding you're staffed for capacity, right?
That's a question for the chancellor.
And I know you guys, the arbitrator yesterday or Saturday ruled what I would read as largely in DCPS's favor, cleared the way for you guys based on this to reopen schools. Now, I know a lot of teachers are still quite upset. Their internal survey shows, I think, like upwards of 90% or a large amount of their teachers do still not feel buildings are safe. Liz Davis, before the ruling came out, had said she would take other avenues or she would consider taking other avenues if this ruling did not go in what she felt was her way. My question is are you fearful that you will have teachers come tomorrow taking sick days? And if so, how will you ensure kids have supervisions and can get into classrooms on Tuesday? And what would you say to teachers today that are kind of fearful about going into the classroom tomorrow?
I mean, I think I answered this exact same question last week, Perry, but we've done everything to make our buildings safe. The difference between your question today and last week is that there has been an independent arbiter who the Washington Teachers Union requested review our MOA, review all of the things that we said that we were going to do, and said that we're doing them, except in the case of needing to reschedule a walkthrough at 2 schools out of 115 schools. And so we have invested quite a lot of resources into ventilation, into testing for students and for staff. We have prioritized our teachers, our in-person teachers, so that they're getting a vaccine. But you see that gentleman that Sam just mentioned? They have gotten 3,100 doses before that gentleman who's probably over the age of 65. We have gone into those buildings to ensure that they have been properly spaced. And we're maintaining cohorts and how the cohorts can function. And we have over 9,000 kids and families who are counting on teachers to be at their assigned location for their job. That's really all I can do as mayor. But I have to tell you that just like anybody who's sitting here, when your boss tells you that this is your location to go to work, that's where you got to be.
And are you guys planning any contingent? Do you have extra subs or things like that on call in case?
I don't really have anything more to add right now, Perry.
Okay, thank you.
Yeah. Yes.
For Dr. Nesbitt, I think that on the race data, thank you for releasing that. I heard you give a bunch of caveats. One thing I noticed is that the total number, if you look at that graph, is larger than the total number of doses administered. Is there an explanation for that?
I think I explained it to you, right? So you don't add race and ethnicity. So someone has a race and an ethnicity.
Right, but even if you add just the race, it's greater than the total number of doses administered by, I think, like 200 or so.
Okay, then I'll have to go back and look at that.
Yes.
Thank you. A couple questions for Dr. Nesbitt. One, you're not on the list to testify before the DC Council today. Can you tell us why you're not testifying at that hearing today on vaccine distribution?
Well, I have other commitments.
Yeah, this one.
And I had another meeting this morning.
And that's simply, I mean, there are several council members who expressed disappointment that you're not there, that you're the decision maker. They would like to hear from you.
Well,
Excuse me. I'm gonna take this one. We have this press conference at this time probably for the last 8 months, And the council hears from Dr. Nesbitt weekly as well. So I don't want to leave the impression with anybody that council members don't have ample opportunity to ask Dr. Nesbitt questions.
Can I ask about second doses? One, I'm hearing anecdotally, like I think a lot of us are, that people are actually having more trouble scheduling and getting their second dose than their first dose. And some people have shown up where they were told to show up at a Safeway and have been turned away. What can you tell us about any problems you're seeing there and how those are being addressed? And then what happens if you don't get that second dose within the 21 or 28 days? What if you go beyond that? Is that a problem that people should be concerned about?
Sure. I want to ask you an additional question before I answer that too, Mark. Are you hearing that extensively locally, or are you also asking that, are you hearing that extensively locally, or are you also asking that in the context of a national
I've only heard
challenge?
from a handful, fewer than 10 people just in DC.
Okay.
And several of them point to the same Safeway that they went and got their first, and they got a CDC card, they say, that says, come back on this date. I think it was January 28th to the Safeway to get your second shot. They showed up. There was a lot of them. They were all turned away, given a list of other options where to go find their second shot, and have had no luck.
Sure. That on its surface does not compute with me, because if you're given a card that actually, when you receive your vaccination, you're given a CDC card that has your actual date that you received your vaccination, okay? You're given the dose, the vaccine that you received, the date that you receive it, and the lot number of that vaccine. On the other side of the card is the next day and time of your next appointment. Okay, that's what's on the back of the card. So it's only filled in for you if you have a confirmed appointment. So I'm not really sure why someone would have the back of the card, was it your next appointment, filled in if they did not have an appointment. The District of Columbia has been very careful to not convert any of the doses that we have been given as second doses to first doses. So we do not have any providers in our network who do not have second doses provided to them to be there for patients when they need them. We don't have a second dose shortage. We don't have a second dose issue. So if someone was given a card where the back of the card, which has appointment date and time, should have actually had an appointment at that location. So we'd like to be able to look into that if that's exactly what is happening. I am aware that early on in the process, we did have some individuals who were given a sheet of paper and told to schedule their next appointment on or around a specific date, and they may not have actually scheduled that appointment on or around that specific date. Now, if that happened, then vaccine would not be there on that date for them. So we are working to make sure that people do not leave the location without actually having that appointment scheduled for them, okay? So that's a loop we want to make sure gets closed, that you don't leave without the appointment actually being scheduled in the system so that vaccine actually arrives for you.
And what about, how important is it to get it within that 28-day
Oh,
or
wonderful.
21-day?
Yes,
what if
wonderful.
you exceed that?
Wonderful. So there is some data that has been released from the CDC that they've been able to look at now for up to 42 days after your first dose, but they do not recommend that an individual would have to start the series over as they continue to look at it. But there's no recommendation that people intentionally use doses that are set aside for someone's second dose so that we can vaccinate more people with the first dose. We're not making that recommendation at all in the District of Columbia. So if anyone has missed their first dose at the 21 or 28 day hallmark, we want to make sure that they get in and get scheduled as soon as possible, as close to that 21 or 28 day, depending on whether they receive Pfizer or Moderna. But it's been looked at up to 42 days.
And then, one last question on this. The Latino number is really very low. what is your, and I know there's a lot of number that aren't reporting there, obviously, but what is your concern about that? Do you have any explanation for
I
that?
can't make any, I would not make any inference from that at all, at all. Like, there's so much data missing. I have no interpretation to make from that.
So you don't think you don't think there's a gap
Mark,
there?
I have no interpretation to make from that. What I will tell you is that we are already focused on Black and brown communities because we know we need to focus on Black and brown communities. But I will make no inference from this data given the amount of data that's missing.
Okay. Okay, last question.
This question for Dr. Nesbitt. I'm sure health directors across the country are dealing with similar issues in real time. Are there other approaches different than prioritizing zip codes that are being used or that are being considered to sort of address racial inequities in vaccine distribution?
Sure, so I'll reiterate what I mentioned, I believe it was last Thursday. So part of the way that we distribute vaccines to those 3 buckets is the big overlay, right, to our equitable distribution program. So the fact that we actually give vaccine to healthcare providers who have an ability to reach the most vulnerable populations is part of our equity model. The fact that we are actually doing on-site vaccinations in senior apartment buildings that are part of the DC Housing Authority portfolio, that we are actually working with DDS and DBH's populations that tend to be have higher numbers of individuals who are racial and ethnic minorities. So those types of initiatives help us to advance an equity model beyond that one bucket of vaccines that are going to the portal, and then we apply an equity lens to that one as well, right? So where you place the vaccine in terms of providers is, in my opinion, the bigger approach in terms of the equity distribution piece. And then the other part that I mentioned Thursday, I'll reiterate, is those community partnerships that help to address vaccine confidence. So how you use your credible messengers, how you do outreach. We've had some senior influencer campaigns, but we've also are working with the faith-based initiatives, and we have some other things that we'll continue to refine in terms of where we place our social marketing materials, how we do our outreach with our mailers that are, we think, very critical to helping to advance the equity approach as well.
And just to follow up on it, though, just to clarify what I think you told Mark, so you have not come to any conclusions or theories as to why these 3 wards are lagging behind?
That was not Mark's question.
Oh, sorry. And my question is, have you come to any conclusions or theories as to why these 3 wards are lagging behind?
Well, you know, it's not lost on, you know, someone like me who has done equity work for a long time, who's worked in been in health departments and has practiced medicine in communities and jurisdictions that are very diverse and have been working to resolve health disparities and health inequities for a long time, that we have issues that are not insignificant when we try to address health inequities, right? So you have, even amongst our healthcare workers and essential workers, a bridge that we need to cross in terms of addressing vaccine confidence. So when you look at healthcare workers, you have Black and brown people who are saying, I want to see what happens to the first cohort of people, even though the first cohort of people are the folks who participated in the clinical trials, right? So we're seeing now more interest in the vaccine amongst those communities. We will continue to see more interest in the vaccine amongst those communities. That's why I'm constantly reminding people we are in week 8 of implementation of the program now. And let's not give up on communities of color being interested in the vaccine. Let's continue to answer their questions. Let's continue to be very thoughtful in how we answer their questions, okay? And let's make sure that the system works for the people, right? So when they want to access it, they can access it in a way that's meaningful.
Thank you.
Thank you.
Thank you, Doc.